A woman named Carolyn walked into my office 11 months ago and said something I've heard in different forms many times, but never with quite that finality. She said, "I've made the appointment. I'm doing the surgery." She wasn't asking for my opinion. She'd already decided. She'd spent over a year watching her neck change in a way that felt faster and more personal than any other thing aging had done to her. The softness under her chin, the vertical bands, those cord-like lines pulling down across the front of her throat like the stays on an old curtain. She was 63. She felt, in her own words, invisible. I asked her one question before she left that day. I asked, "Do you know what's actually happening in the muscles under that skin?" She didn't. And that question, and the answer she didn't know yet, is what I want to give you today. Because there is a muscle most people have literally never heard of. It's called the platysma, and it is the single structure responsible for what your neck looks like, what it feels like, and how fast it changes. It is also the one muscle that almost nobody deliberately trains. Not because training it is difficult, because nobody told you it needed training. If your neck has started to look different than it did a decade ago, the slight looseness under your jaw, the bands you didn't have at 40, the way the skin no longer sits quite the way it used to, what you're actually looking at is not a skin problem. You are watching a muscle that has been in slow retreat for years without a single workout. And what I'm going to show you today is why 2 targeted minutes, done correctly, in a specific sequence, at a particular time of day, can change the trajectory of that muscle in a way that no cream, no device, and nothing done under general anesthesia actually addresses at the root. Right now, if you want to try something, press 2 fingers gently along the front of your neck, just below your chin. Feel that slight softness? That's the platysma. By the time this video ends, you'll know exactly what's happening in that tissue and precisely what to do about it. If you want to follow along with that, write platysma in the comments. I want to know you were here for this one. Let me tell you what the platysma actually does, because once you understand this muscle's function, everything that happens to the neck with age stops being mysterious and starts being logical. The platysma is a broad, thin sheet of muscle that runs from your collarbone across the entire front of your neck, all the way up to the corners of your mouth. Its job is to create tension across that surface, to support, to pull, to anchor. The cosmetic surgery world calls what it does maintaining the neck envelope. I prefer to describe it as scaffolding because that's a better picture. Think about scaffolding on the outside of a building during renovation. When it's properly erected, the connections tight, the poles plumb, the whole structure tensioned correctly. Everything attached to it looks organized and held. Now imagine that same scaffolding left standing through 5 winters without maintenance. Nobody repairs the loosening joints. Nobody retensions the connections. The poles start to shift. The whole structure softens. The material draped across it, which was once pulled taut, starts to sag between its anchor points. The building underneath didn't change. The scaffolding failed it. Your platysma is that scaffolding. And here's what most people have never been told. Skeletal muscle, any skeletal muscle, begins losing mass at roughly 1% per year from your mid-30s onward. If you don't deliberately load it, challenge it, contract it against resistance, that rate doesn't stay slow. The platysma, being a muscle that nobody puts in their workout program, receives no stimulus. So it loses tone at its own pace, quietly, year by year. The visible effects compound over time. When the platysma weakens, the skin it used to support from below no longer has the same internal structure. Those vertical bands you can see on the front of some people's necks, those aren't the skin pulling apart. Those are the lateral edges of the platysma losing their integrated tension, pulling slightly away from center as the muscle deflates. You're not watching skin go loose. You're watching a muscle in retreat. And that distinction is everything. Because skin and muscle respond to entirely different interventions. In 20 years of practice, the consistent pattern I've observed is this. The patients who age best in this region are almost always the ones doing some form of deliberate neck and jaw resistance work. They didn't necessarily know that's what they were doing. Some of them were singers. Some were swimmers who spent years doing crawl stroke. Some just had a habit, an old physical therapy routine, a chin tuck exercise someone taught them decades ago. The common thread wasn't genetics, it was stimulus. Now I want to give you the mechanism, because the why matters as much as the what in this case. Muscle tissue maintains its tone, its firmness, its structural integrity through a process called mechanotransduction. That's the biological signal pathway that begins when a muscle fiber is loaded, stretched, or contracted against resistance. Mechanotransduction tells the cell, you're being used, maintain yourself, adapt. When that signal is absent because the muscle sits unused, the opposite program runs. The maintenance routine winds down, the fibers thin. Think of sourdough starter. You know the image, that small jar of active culture that a baker keeps alive on the counter. When it's fed regularly, kept at the right temperature, stirred and activated, it stays vital. It bubbles, it rises, it does its job. Leave it in the back of the refrigerator for 3 months without attention, and it doesn't vanish, but it goes flat, inert, unreactive. You have to work to bring it back. The baker who tends it daily never faces that problem, because the culture never collapsed in the first place. Your platysma responds to the same logic. It doesn't disappear, it deflates. And deflation, unlike disappearance, is reversible if you apply the right stimulus. The specific mechanism of recovery involves 2 things happening in sequence. First, eccentric loading, the controlled lengthening of the muscle while it's under mild tension. When you stretch a muscle while it's resisting, you create microtension through the fibers that signals repair and rebuilding. Second, isometric holding. Maintaining a fixed contraction against a load drives blood flow and oxygen deep into the tissue. Together, in the right order, these 2 phases create the stimulus the platysma hasn't received in years. There's one more piece of timing that most people miss. The platysma is most receptive to eccentric load in the early to mid-morning, when cortisol is still elevated from its natural peak and circulation to the musculoskeletal system is at its daily high. Late evening neck work isn't wrong, but you're working against the biological window. The muscle is in repair mode at night, not rebuild mode. That distinction affects your result over months. Now, I know what some of you are thinking. This sounds too simple. There are surgeons charging significant sums for neck lift procedures. Surely the problem can't be addressed by 2 minutes of morning exercise. The surgery doesn't rebuild the muscle. I want to say that clearly. A neck lift, platysmoplasty, or a traditional lift repositions and tightens the existing tissue. It does not address the underlying atrophy of the platysma, which is why in the absence of muscular rehabilitation after surgery, the results gradually diminish. The scaffold loosens again, the visible changes return. You corrected the drape without fixing the structure it hangs from. The patients I've observed who hold the best long-term neck outcomes, whether they had a surgical procedure or not, are the ones who commit to rehabilitating the platysma. In the patients who do the muscle work and never have surgery, many of them never develop the severity of change that would have made them a candidate. Carolyn was one of them, but I'm getting ahead of myself. Here is the protocol. 2 minutes, every morning. I'm going to walk you through every step, every hold duration, and the biological reason behind each one. Because if you understand why each second matters, you'll do it correctly without depending on memory. Start seated, upright, with your chin level with the floor. Not tilted back, not forward, level. This neutral position places the platysma at its resting length. Not pre-shortened, not pre-stretched. You need that baseline before loading begins. Take 2 slow breaths. Let your shoulders drop. The resting tension in your shoulders connects directly to the muscle's available range, so starting tense costs you range you need. Phase 1. Slowly tilt your chin upward, not past 45 degrees, until you feel a distinct, gentle pull along the front of your neck. Not pain, a pull. The skin over your platysma should feel taut, and underneath it, a sensation of mild resistance. If you feel nothing, add a 1/2 inch of extension. Hold that position for 30 seconds without moving. This is the eccentric phase. You are lengthening the platysma under mild load, and you're holding it long enough for the mechanotransduction signal to propagate through the fiber. Below 20 seconds, the signal doesn't have time to build. Above 45, you've passed the working window. 30 seconds is exactly where the stimulus lives. From that extended position, without returning to neutral, turn your head slowly to the right, no further than your comfortable range, and hold for 15 seconds. Then turn left, 15 seconds. Return to center. Come back to neutral slowly. This diagonal loading is what separates this protocol from any generic neck stretch. The platysma has fibers running in multiple directions. A straight extension loads the central fibers only. The diagonal rotations load the lateral bands, the ones responsible for those visible vertical cords. You cannot address the lateral bands without rotating under extension. Most people skip this step because it feels subtle. It isn't subtle. Phase 2, return to neutral. Now, press your tongue firmly against the roof of your mouth, as hard as you comfortably can, while simultaneously pushing your lower jaw very slightly forward. Hold that combined contraction for 30 seconds. You should feel the platysma engage fully across the front of your throat. The tongue press activates the suprahyoid muscles. Those are the muscles immediately above the platysma that help define the jaw to neck transition angle. The jaw forward position loads the platysma from below. Together, they create a co-contraction pattern, both muscle groups working simultaneously, that produces the strongest stimulus the platysma can receive without any external equipment. That sequence is the entire protocol. 30 seconds of eccentric extension, 15 seconds each diagonal rotation, 30 seconds of isometric co-contraction. Total, 2 minutes. But only if you do it every morning. The stimulus is cumulative. Missing 2 days isn't catastrophic. Missing 2 weeks begins to erase what you've built, because the mechanotransduction signal requires consistent repetition to shift the muscle from passive maintenance into active rebuilding. Now the mistakes. Because the gap between doing this and doing this correctly is where most people lose their results. The first mistake is tilting too far back. Past 45 degrees of extension, you compress the small joints at the back of the cervical spine. You lose the platysma stretch and gain stress on the vertebrae. Instead of loading the muscle, you're straining the joint. If you feel discomfort at the back of your neck during this protocol, you've gone too far. The correct sensation is at the front, always the front. The second mistake is speed. People rush through the holds because stillness feels unproductive. But an eccentric stretch, held for 8 seconds instead of 30, delivers almost none of the signal you need. The biology is specific here. The repair signal starts accumulating around 15 seconds and peaks at 30. Rush through it, and you've spent 2 minutes in your kitchen doing almost nothing for the muscle. Slower here genuinely means more, not less. The third mistake is the real enemy of this protocol. It's inconsistency combined with impatience. 4 days of practice, no visible change. Conclusion, it doesn't work. The platysma has been in slow decline for 10 or 15 years. It doesn't reverse in 4 days. The consistent clinical pattern I've observed is this. The first perceptible change, a slight increase in firmness, a subtle reduction in the depth of the lateral bands, typically appears somewhere between 3 and 6 weeks of daily practice. Patients who stop at 2 weeks never see it. Patients who continue past 6 weeks often find they don't want to stop because they've started watching the change happen, and that is its own motivation. The enemy in this story isn't your age, your genetics, or the rate of change you've already noticed. The enemy is the combination of 0 stimulus and 0 patience. That combination is what makes the decline feel inevitable. That combination is what fills cosmetic consultation waiting rooms with people who believe they've run out of non-surgical options. Once you've done this protocol correctly for 30 days, here's how you deepen it. Add very light resistance to the eccentric phase. Place your palm flat against your chin and apply gentle upward and back pressure, just enough to feel a slight increase in the stretch sensation at the front of your neck. Your head stays still, your palm creates the resistance. This moves the stimulus from passive stretch into active eccentric load. The difference in fiber recruitment is meaningful. You don't need significant pressure. The platysma is a thin, broad muscle, not designed for heavy load. A few ounces of gentle resistance is all you need. Second, do the protocol before your first coffee. Caffeine causes mild peripheral vasoconstriction. It narrows blood vessels slightly, which temporarily reduces circulation to muscles on the body's surface. Doing the protocol before caffeine means maximum blood flow during the stimulus window. 10 minutes before your first cup. That's the only scheduling variable that meaningfully affects the outcome over months. Third, drink 8 ounces of water first. Muscle tissue that's mildly dehydrated, even the ordinary mild dehydration most people wake up with, has reduced pliability. The fascial layers surrounding the platysma respond to eccentric stretch far better in a well-hydrated state. This sounds too simple to be significant. It isn't. Carolyn canceled the surgery. Not because I pressured her. I presented the mechanism, the protocol, and the pattern I'd seen clinically, and I left the decision where it belonged, entirely with her. She tried the protocol for 8 weeks. At 8 weeks, she came back with photographs she'd taken herself. Same angle, same lighting, side by side. The lateral bands were measurably reduced. The jawline to neck angle had shifted. She wasn't 25, but she was present again, in her own face, in a way she told me she'd stopped expecting. What changed wasn't her skin, it was her platysma. The scaffold went from inert to active, and her skin responded to what was happening underneath it. Because skin follows muscle, it always has. When the structure beneath tightens and rebuilds, the surface adapts. Not instantly, not dramatically, but consistently, over weeks, in the direction of recovery. You now understand something that most people entering cosmetic consultations don't know to ask about. You understand that the vertical bands, the jaw softness, the neck change you've noticed in photographs, those are not skin aging. They are muscle atrophy. And muscle atrophy has a known, reliable, well-understood solution: progressive, consistent stimulus. The platysma hasn't been challenged in years. That's not a failure. Nobody put it on the poster at the gym. Nobody mentioned it at your annual physical. Nobody told you there was a muscle there, let alone that it needed work. But you know now. And the protocol you have costs nothing, takes 2 minutes, and starts working the first morning you do it correctly. This kind of change doesn't arrive with fanfare. It happens the way the decline happened, quietly, daily, and in the direction it's pointed. You get to choose the direction now. If you want to stay close to this kind of information, mechanisms over myths, protocols over products, actual biology over marketing language, subscribing means you won't miss the next time I find something worth explaining this carefully. And the final thing I want to say, the protocol I gave you today costs nothing. No equipment, no waiting room, no appointment, no risk. The only thing it costs is 2 committed minutes every morning. If you're going to try it, and I genuinely think you should, tell me below that you're starting today. Because a commitment set out loud is harder to abandon than one kept only in your head. The platysma is waiting. It has been for years.